Welcome to the podcast version of the TriHealth Medical Minute. Mike McConnell, my guest who's joining me this week, will be a primary care physician talking about primary care, Dr. Robert Travez. And first of all, doctor, it's good to have you here. How you doing?
I'm doing great. It's good to be here.
You betcha. Primary care physicians, I mean, everybody should have one. Not everybody does. What would you say that your thumbnail sketch of your basic responsibilities as a primary care physician?
So basically, we're like the first line of defense when it comes to treating mostly anything. Any sort of chronic conditions, diabetes, hypertension, that's what we do. It's what we specialize in. Mm-hmm. We have a lot of roles also in annual physical exams, Medicare wellness checks, just making sure that we do just the regular checkups, making sure that health is where it needs to be. Those are probably one of the bigger things that we have. Also, annual cancer screenings, things of that nature.
Sure.
That's kind of our bread and butter.
I think maybe we all know somebody who hasn't been to the doctor for years or decades or whatever, and especially if it's somebody related to you, the best way to explain to them that it's important to go at least be checked up on.
Well, yeah, there's a lot of people that come in for the first time, and they haven't been seen by a doctor in, 5, 10, 15, 20 years sometimes. Yeah. And I always like to tell them that no matter how good health is at the moment, you never know what tomorrow will bring. So it's important that you have someone that you can reach out to. It's important that there's someone available to address concerns, answer questions, to look out for anything that just kind of might be just smoldering in the background that no one's really aware of yet. And that kind of goes to the idea of your annual checkups, getting blood work on a regular basis, just to make sure, that we're taking a peek under the hood essentially, and that there's nothing that we need to, act on before it snowballs into something bigger. So basically, you might be good right now, and hopefully it stays that way. We work hard to make sure it stays that way. But in the event that anything happens, you want someone that you can reach out to.
And I guess it makes sense to be with one primary care physician for a long time, somebody who, to a degree, knows you and knows your history, correct?
Oh, yeah, for sure. I always tell everyone, make sure whoever you're seeing, whether, whatever doctor it is, whether it's a specialist or whether it's your primary care doctor, it's someone that you feel like you can connect with, someone that you feel that you can trust, someone that you feel is, professional and is being responsible and doing what they need to do. Because it's only when you have that sort of relationship, when you see that there's that sort of responsibility and professionalism on the other end, that you feel more open to talk to them about any issue. If you feel like you can't connect with them, if you feel like you don't know them all that well, then there's always that little barrier there, and you might be a little bit hesitant to ask for help when you might need it.
Seems most people I know who don't go to the doctor for long periods of time are men, and I think men just they don't like the idea of getting bad news, I think. But if somebody were to go to you, and they hadn't been to the doctor for some time, what should they expect? What sort of screenings should men get at what ages?
So there's a number of different screenings. For men in particular, obviously you want to make sure, we're checking prostate levels. Now we can do that during the physical exam with something called the digital rectal exam, but there's also blood work that we can do to check on that as well. Colon cancer screenings, not just for men, it's for men and women, of course, but that's something that we need to be aware of, and that's age-related. It depends what your family history is. It depends if there's any sort of history of cancer already, and that'll help us determine when, how often you get these exams done, and based on what we find, that's from every screening to every screening. It might be every year, every 3 years, every 5 years, things that we would do. I think you might be right. Maybe men, I think, are a little bit more predisposed to the doctor. But I think it's important that you point out, again, you want to make sure that they stay healthy. A lot of times men just kind of feel fine. They think, health is going great. There's no news. They're kind of just living low. And I think when I point that out to my male patients, they kind of get that. They understand that, life is going great. Health is going great. Let's do what we can to do to make sure it stays that way.
So aside from an annual checkup, other reasons why people go to the doctor or should go to the doctor. An example would be, we all know there's no cure for the common cold. So if I get a cold, I don't bother going to the doctor, but I know other people who do.
So, the problem, this is the problem with like the common cold and things like that. There's a lot of conditions that can look like the common cold. Obviously, what's always in the headlines is COVID. COVID can look exactly like the common cold. It can be very, very mild. People can just think they just have the flu. They just want to, just maybe stay home and just like take it easy, but they're not really thinking, oh, COVID, or they're not thinking, maybe it's a sinus infection, or maybe it's acute bronchitis, or if there's a history of underlying COPD or asthma, maybe it's an exacerbation of one of these chronic lung issues. All of these things and many, many more things can look very, very similar. And just from the surface, it can be very hard to tell the difference. That's why even if it's just the cold, and even if it's just something that you think you can kind of just like take it easy at home for a little bit and just get better eventually in a few days, it's always good to reach out to make sure it's not something more than that. Because going back to the example of an asthma exacerbation, if this is actually what's really going on, you want to make sure that you're on the right medications to make sure that asthma exacerbation doesn't land you in the ER or in the hospital. So, and again, it starts out seeming like the flu. You know what I mean? And even if it is the flu and there's a history of an underlying chronic respiratory issue, it could make that worse, and on top of just being the flu. So there's a lot of factors to consider. It's tempting just to stay home. It's tempting to not, go out of your way, go to the doctor's office, make an appointment. It's very, very tempting. I understand where that comes from. But I always motivate my patients to just call. At the very least, call. There's a lot of things that we can triage over the phone. There's a lot of things that we can handle. I'm happy to call in medications. I'm happy to get a brief history over the phone and get the ball rolling on something, just to make sure it doesn't turn into a bigger problem.
I guess another way you can try to handle things is through something like MyChart. For those who haven't used MyChart, explain how that might work.
Oh, so MyChart is this awesome tool that we use. It is essentially an app on your phone. They have it for Android. They have it for iOS, and it serves a multitude of different purposes. MyChart, you can use that for to schedule appointments with your primary care doctor, with the specialist that you see. You can use it to communicate with those doctors as well. I'm a doctor, and I communicate with my doctor through MyChart. I use it all the time. You can request your medication refills through MyChart. There are there's a portion of that app that lets you see the results of your lab work, whether it's like an imaging study, like a CT or an X-ray, or whether it's lab work. All that information gets pushed out to MyChart. So actually, I always tell my patients, the moment I get that information, they actually get that information. So it's available to them immediately. And I think providing this sort of objective information to patients is motivating. When they see that, there's numbers that are out of the normal range, or there's like an issue with an imaging study that looks a little weird, that motivates patients to follow up on that, to talk to their doctors about that. So that's one of the personal reasons why I like MyChart a lot, other than it being a very useful tool for all the other reasons that I mentioned.
Sure. People can learn more about primary care physicians. Find out more. Visit TriHealth.com/primary care. Speaking with a primary care physician, Dr. Robert Travez, and you partner with other physicians through TriHealth. And if you have a patient of yours who has something serious, they have cancer, they have a heart condition, whatever the case may be, this is, it won't say you huddle up, but the doctors are very much in communication with each other.
Oh, yeah, for sure. Actually, I did my training at Good Samaritan Hospital in internal medicine, and one of the reasons why I decided to stay in Ohio, stay with TriHealth, was because of the rapport that doctors develop with one another, because of that ease in communication. I'll give you an example. I had a patient that came in just without even an appointment. They just showed up. They had this terrible earache, and it looked like they damaged their tympanic membrane, which is a part of your ear that you never want to damage. And she was having ringing in her ear. It was very painful, and she needed to be seen like immediately by a specialist, by an ENT, an ears, nose, and throat doctor. So in my building, I'm on the second floor of my office building. That's where all the internal medicine, primary care doctors are. Yeah, family medicine down there as well. All I did is I just go upstairs. I speak to the MAs and the nurses that are working with the ENT doctors that we have. I let them know what the situation is. Immediately, they carve out some time in their schedule, and we bring her right upstairs. So it's that sort of communication and that sort of solidarity between providers that I really appreciate personally. We have tools that we use to communicate between providers, and everyone is always very responsive. Everyone is always, more than willing to lend a hand when it comes to these cases that just need a little more attention, that need a little more help, that need the attention of a specialist. That's something that I always really liked a lot, and that was one of my reasons for actually staying here with TriHealth.
And it would no doubt lead to more positive outcomes for more patients that way.
For sure, yeah.
All right, sometimes people put off seeing a doctor or just taking care of their health in general, exercising and eating properly and things of that nature. How do you encourage, in particular, male patients to keep up with seeing the doctor and just living the way they're supposed to live?
So I think the first step to that is forming, a good rapport with your male patients. I mean, I think, communication and forming that doctor-patient relationship is a bedrock of medicine. That's how we practice good medicine, is by forming that relationship. That's step number one. Step number two would be understanding what their issues are. Letting them know that, hey, you may feel fine right now, but if there is, for example, a smoking history, well, we need to make sure that, we do appropriate screening for lung cancer, for example, if they meet the criteria for that. Understanding what other issues, concerns that they may have. Because a lot of the time, men and women, I'm not just going to say that this is just for men, but a lot of the time, patients can have, issues that they're just quietly dealing with, like anxiety or depression, things that on the surface, nobody really sees, you know what I mean? But, they confide in you and they tell you about these struggles that they have, and just letting them know that there are ways to go about treating this, and that does require following up with your with your doctor. It does require making the time, every few months to make sure that, everything is taken care of. Letting them know that there's appropriate treatment modalities for whatever they might have going on. That usually encourages them and gets the job done when it comes to motivating them to come back to the office and seeing you. And again, just making sure that they're living their best life, that they're eating healthy, they're staying physically active, letting them know the benefits of these lifestyle changes. And how it helps them, throughout various different, portions of their life and their health. I think that also helps out tremendously too.
So then on the less strictly physical side of things, you have people who suffer from stress and anxiety, and the holidays are coming up, and that can add to it for some people. And depression is yet another issue. That's something a patient should be talking to their primary care physician about, correct?
No, for sure. I mean, stress and anxiety, depression, these sort of mood disorders are something that we see very, very, very commonly. The first step isn't, all right, just immediately seeing a psychiatrist or anything like that. No, you see your primary care doctor, because that's something that we handle on a regular basis. And like I said, this is something that not a lot of people from the outside looking in, it's not very obvious to them. But when patients, have that history, or when a diagnosis is made, you really want to make sure that certain times in the year that these people are being checked up on. Because the holidays is a very difficult time of the year. It's very difficult. It's challenging for people that have lost loved ones, that are going through struggles, financial or otherwise. So you want to make sure that they're getting taken care of. You want to make sure that the medications that they're on are working and controlling symptoms. You want to make sure that they also have that relationship with behavioral health as well. It's something that, that we help coordinate tremendously. We have behavioral health in my office, and I am a huge proponent of making sure that this is something that's taken care of. And this is something that not just, I just don't like to just preach about this to my patients, but there was actually something that happened to me recently that was very, very traumatic and very tragic. And I needed help. I felt like I was just saying everything was fine, everything was okay, and I was kind of just like pushing it off and just, putting it to the side. But then I really realized that there was something missing there, that I needed some help dealing with this. And that's why I'm a huge believer in making sure that, people with behavioral health issues get the treatment that they need. Because just with my own experience, I know the benefits of, talking to someone. I know the benefits of these medications that a lot of people, that I start with a lot of people. And I also see the benefits with my patients themselves. It's something that it's tremendously useful, but it can be very, very, very overwhelming if it goes untreated.
All right. Our time is up. I appreciate yours. My guest has been Dr. Robert. Is it Travez or Travez?
Travez.
Travez. I got it right the first time. Well, listen, I appreciate your time here today, and I want to say for more information or to find a primary care physician, TriHealth.com/primary care is where you would go. So, Doctor, I appreciate your time once again, and enjoy your holidays as they come along.
You too, and thank you very much for having me. I really appreciate it.
You betcha. And thank you for checking out the podcast, the TriHealth Medical Minute Podcast at 700WLW.com. W.com.